Well, it looks like we are right there at 11 o'clock Central Time and 10 o'clock Mountain Time. So uh, I'm Rob Eirich. I am a committee member with the Animal Care Wednesday webinar series. Today I'm going to be hosting as well as presenting. Um, Most of us are familiar with the process. These are recorded and will be actually posted on the Animal Science website at UNL under Animal Care Resources. And so we will get started today. We will have a poll as we kind of get toward the end when we get to some question time. If folks will stick around and finish that as well and can participate in the poll. But we will go ahead and get started today. And the topic for today is animal health stewardship, but also probably the key part of the presentation today will be focused around storage and handling information for animal health products. It's always one of those things I think can get overlooked over time, and sometimes we have a tendency of kind of thinking that we are storing things properly, but probably not going back to really realize temperatures and those type of things. So with that, we'll kind of jump into it. As we all know, with antibiotic resistance being a big buzzword within human medicine as well as veterinary medicine, we do know that antibiotic resistance or antimicrobial resistance is real. And so, how do we use the best stewardship we can to really make sure we are treating things properly with dosage, diagnosis, therapy, and route of administration? But probably the key part is really the second definition on the slide now is antimicrobial stewardship seeks to achieve the optimal clinical outcomes related to antimicrobial use. And so we want to make sure that we have products that we're using, whether it be vaccines for preventative measures or antimicrobials or antibiotics, to make sure that we have those products that have strong efficacy for those things that we're treating without creating some resistance or additional infections or additional risk of infections to these animals. And so, again, when we think about that, I think it's probably important as we handle these products that we understand how we really take care of them as a whole. So, let's kind of jump into vaccines first. And everybody understands usually with vaccines, we have killed vaccines as well as modified live. But all of those vaccines, when we think about storing them, we all know that we need to keep them in a cool space, cool storage, whether it be handling or transporting them or storing them. And so usually refrigerators at 35 to 45 degrees Fahrenheit is kind of the key area for storage with those products. And so we're all very familiar with that because we've known that for years. And every time we work with our veterinarian, with our veterinary our client patient relationship, we know those products need to be stored in those direct cool refrigerators whenever possible. We also understand they need to be out of direct sunlight. When we're mixing, we understand we should mix as we need that product and no more than an hour prior to administration. Those things I think we're very good at when we start working with those type of products. We'll talk a little bit about some syringes and needles kind of as we go along as well. But one of the things as we look at vaccines when we're handling them, probably the key thing that we need to remember is if we're using a modified live and a kill vaccine both at the same time, and that is our protocol over our animal health program, we have to remember to make sure that we're using modified live product in the same syringe each time. You don't want to be flip-flopping syringes, so we're using this syringe for modified live today. Next week, we're going to process more animals or more livestock, and all of a sudden we put a killed product into that modified live syringe. there's always a risk of some residues. And so when we think about residues in those syringes, even though we clean and we do our best to keep them as clean as possible, there's always that risk. And so those are things we have to kind of think about, making sure that we're always using modified live in the same syringe, label those syringes somehow, and usually it's pretty simple, just a MLV on that syringe somewhere to keep us reminding us to make sure we're using those products in that syringe. The other thing is just making sure we have proper needle sizes, and I'll show you a chart here as well that we have with beef quality assurance for the beef side of things, but I'm pretty sure that all of our animal quality assurance programs have some guidelines on that particular piece as well. So one area that I don't think we have done a very good job with as an industry as a whole is understanding handling and storage of antibiotics or antimicrobials. Sometimes I know there's probably a number of us that will jump into a farm truck or a ranch truck or wherever, the feed truck maybe even at that point, and we will find a bottle of antibiotic laying on the floorboard or on the dash. And so we have to really think about these type of things, because not very often do we read the storage information on antibiotics. I found that in a number of number of operations I've worked with. And so as you kind of look at this, we start to look at some of those opportunities that we have that might affect that efficacy of that product if we get out of that storage information. So one of the examples, as you look at here, I had 5 different products. Now 5 different products, I found 5 different storage information as far as temperatures go. We have some that are below 77, below 86, in a range from 59 to 77 or 59 to 86, 68 to 86. And so all these products are so much different. And so an example that I have is photo here, a picture that was on the dash of my vehicle, my pickup, here parked at our facility. Outside temperature was 38 degrees. Pickup just parked in the parking lot on a nice sunny day. Granted, it was 96 degrees Fahrenheit on the dash of that pickup at noon. And that's just parked. And so the 2 product boxes I have there, one of them would say that that product is out of that range, their storage range. The other product can go up a little bit even higher than the 96 degrees. But again, what did I do to the efficacy of those products by taking it? Because more than likely, if that product was there on the dash of my pickup at noon, it was probably there on the dash of the pickup overnight with freezing temperatures as well. And so again, we take those products, we look at them, and I think that's probably the key part, is as we take those products out to use them, or even in the summer, in our ranch scenarios where we might put this product in a saddlebag or in our pocket as we go out to check livestock on range, can we get to a point where that product is out of that temperature zone that is for proper storage? And yes, very easily that can happen. So we constantly encourage folks to, as you transport it, as you're using it, as you're out using the product in a processing facility, in the barn, in the parlor, wherever you're working some of these facilities at, again, making sure that you even keep those antibiotics and antimicrobials at the proper storage temperature. So let's just kind of review some of these as you look. A product that is very heavily used within the feed yard industry with some respiratory and those type of things that we see a lot being used is a product called Draxxin. Draxxin needs to be stored below 77 degrees Fahrenheit. So again, that's a product that when you think about the cost and that product that we use and the efficacy that we want to occur by using this product with some respiratory disease or foot rot, we have to make sure that we're not storing that product outside that range. And so again, can it be 77 on the shelf in the processing barn? It very well could be. I've gone to again, my scenario with BQA, going to a feed yard where they have a couple bottles that are sitting on the shelf at the processing barn through the summer months, and that barn is well over the 77 degrees inside. And so again, those are things that we need to look at. Biomycin, the same thing. It needs to be stored in a controlled environment, room temperature, and that has a range between the 59 and 77 degrees Fahrenheit. Another product, Exceed. We add some information here because storage information and how we handle a product like this, the storage information is between 68 and 77 degrees Fahrenheit. And so the cold side is also a concern as well as our top end side. But another thing that we need to understand is with the storage information of this product, it also has on that storage information that we need to use the complete bottle within 12 weeks of the first draw or the first dose being removed from that bottle. So again, we keep thinking about the half-life and the efficacy of that product. So when we have, depending on the number that we might have a risk of using this on, that are in that risk area, what size of bottle do we need on a product like this? And so what is our dosage? How do we control that? And also understanding as we handle this product, especially how we administer that product. It's a product that is supposed to go within the ear. And so when we look at Exceed, if that product is accidentally given sub-Q or intermuscular at another location, the whole withdrawal time changes to a lot longer in that particular time when you think about only 18 days if it's done properly in the ear location. And so again, things like this we have to really understand when we start talking about handling, storage, and usage of that type of product. Another product, again, the storage information between the 36 and 86, a bigger range on a product like this. But again, if you read that storage information, it needs to be used within 28 days of the first dose being drew out of that bottle. And so storage and handling again on these antibiotics becomes a key factor in the efficacy as we look at what we use and trying to maintain good stewardship practices within our industries. So I encourage a lot of folks to start to look at trying to get some thermometers to really making sure that we have those proper temperatures. We have put these together and put out within the BQA folks here in Nebraska because I think it's important because, example, again, a vehicle in December was 24 degrees. 1 hour later with the heater on, it was 84 degrees within the cab, and the exterior temperature was 22 degrees at that time. So again, as we look at those type of things, where are we putting those products or how are we transporting those products and keeping that key piece in mind. The other thing is with refrigerators, I really, we'll talk about it in our next slide as well, but refrigerators, making sure they stay the right temperature and are consistent in their temperature is also very important because as we see here in this next slide, so this refrigerator is a refrigerator that they're keeping all their animal health products in. But where was this refrigerator probably prior to where it's being used now? And more than likely, looking at this fridge, it was probably the refrigerator that was in the kitchen of the house. And why is it no longer in the kitchen? It probably was keeping things too cold or maybe not cold enough. And so that fluctuation was probably the reason that it was exchanged out of the kitchen for a new one. So then we take it and we put in some of our vaccines or animal health products, but then we think about what's the cost of those products that we're putting in this fridge. And so if that refrigerator is fluctuating so much, again, knowing what that is, so a thermometer, a digital thermometer, all those are fairly cheap, but understand what that refrigerator is doing as well. Some things to think about is making sure that they're clean. As we see here, potential for cross-contamination, product that might be in there that probably needs to be disposed of. Some disposal of some of those products. Example would be those products that might be a modified live that was mixed and unused. We put it in the refrigerator. Remember that those are only good for about an hour to 2 hours at the most, where they are a viable product if they're a mixed modified live, before we actually get it in the animal. So again, when you look at those labels and understand that, that's pretty important. But keeping them clean, making sure we're maintaining a good temperature. Also, it's recommended that you don't store some of those vaccines in that door panel. Because again, as that door opens and closes, as we take product in and out, the fluctuation of those temperatures could change that product a little bit. And so it's always encouraged to store most of your products in the kind of the central or center portion of that refrigerator, of that cool area, where you don't have some of those fluctuation pieces as well. We all seen these coolers. You can make coolers as you're moving these products from location to location. There's some companies that have designed and created some product or coolers that have locations for syringes, organizers within the inside of them. They are out there on the market. Most of them, some of our pharmaceutical companies. The blue cooler in this particular picture is from a pharmaceutical company. And so, again, those are products that are available to use, but we can actually simply create our own. This is a vaccine shipping cooler that most vet clinics would get their product in. Basically cutting 2 holes in a styrofoam cooler for syringes. That way we can keep our cold packs in our product inside of them is pretty simple. Other things, as I talk about antibiotics, going out on range conditions or location to location, a simple lunchbox cooler can be as easy as anything to keep that product in with some type of a cool pack. Or even in the wintertime, a warm pack of some sort, depending on what your temperatures that you're dealing with are. And so they're all out there, they're available, but keep in mind we need to keep them clean and organized as well in those type of things in this scenario. Needles, we'll talk just a little bit as we handle this product, making sure that syringes and needles are clean. With good hot water is usually the top piece. And then one of the other things that we continually look at is making sure we have the proper needle sizes. This diagram is what's been published in our BQA materials for a number of years based on size of animal. 16 to 18 gauge needles is kind of the key part there. Sub-Q, 1/2 to 3/4, with intermuscular 3/4 to 1 inch. There's probably a few products out there that are thicker antibiotics that get thicker in the cooler season, winter, late fall, early spring. Those products probably will require a 14 gauge needle. And so when we look at that, kind of think about those type of products as they get real thick, trying to get them through a smaller needle becomes more difficult, but kind of making sure that we pay attention to those type of things. The other thing is when we talk about cleaning needles and administering these products or handling these products, having clean needles, how often do we change needles? And the reason I put this in here is we should never put a used needle back into a bottle to refill a syringe. that should always be a new needle going into that bottle. Contamination and the risk of cross-contamination increases as we use a used needle. If you look at the top left-hand picture is a brand new needle, and then used once as you go down, and then across up to 15 times. And when you look at those needles, you see the residue that remains in the needle. And so when you think about that needle, if you put it back in the bottle, now we contaminated the bottle, but if we draw through that needle back into the syringe, there's a risk of cross-contaminating the syringe as well. So in this particular instance, if we change every 15 head, we risk cross-contamination of 15 head potentially of a blood-borne disease. But if we put it back in the bottle, now whatever that bottle dosage is, we contaminate that whole piece, but as we draw back into a syringe, now that syringe is cross-contaminated as well. And so those are some things that are interesting to see. Keeping that in mind as you handle these products for efficacy is always important as well. One of the things that I like to pass on to folks is the opportunity to making sure that we have the most updated labels of products. And so I encourage them if they are into apps for your smartphone, your iPhones, those type of things. Here's an app of the Compendium of Veterinary Products that you can get through the Google Play Store as well as the Apple Store. And so when you see this app, it's an app that actually gives you, you can actually put in there you can sort it by species, you can sort it by disease. And so what I did here is I actually went to beef cattle, put in bovine respiratory disease, and what happened is it gives me everything that's labeled to treat bovine respiratory disease. And once I selected a product, it gives me the complete label, storage information, everything that's there that we would need to utilize that product correctly. And so there's some opportunities to utilize some of those type of pieces as well. And I wanted to pass that on to you. But reading labels when we start talking about storage information and handling is always a key. That kind of wraps up my presentation piece, kind of a short webinar today, but there are some resources that information is on here in Nebraska, and so I offer those to you. Our beef.unl.edu website, bqa.unl.edu, as well as bqa.org. Those websites all usually have some animal health and animal product stewardship information on them, and so those are some opportunities that we have where we can get some resources as well. So with that, I believe I will, I'm going to launch the poll. So you can actually take the poll if you are online. And with that, I would open it up to any questions you might have via chat, and I can answer some of those if there's any questions. The question that came up in chat is making sure that we have proper disposal of unused or expired product. We really encourage folks to work with the veterinarian on some of those products to make sure that we dispose of them properly in that direction. Probably one of the things that we don't like to see these products being disposed of down a sink as far as that goes. As you pour that down, some concerns that we might have there is that product being maybe getting into circumstances, some of these products by touch and getting it on ourselves, that can do some irritation and cause some issues there. We really encourage as much as possible to work with your veterinarian to know what is the best way in your given region or area to take care of those products. When we look at disposing of needles, we encourage you to use sharps containers. And again, working with your clinics, our area, even our area hospitals can give you some information on where you can actually dispose of your used needles as well. But again, most of our veterinarians will help you with sharps. Other things, if you don't have a sharps container, recommended using like a heavy laundry detergent bottle, putting your needles into that, making sure once you get it filled, you can actually, one of the recommendations in the past has been put a little quickcrete concrete in there and some water, let it solidify, seal the cap on, and then those can be disposed of in a general dumpster as well. And so if you have some concerns on certain locations where you're at by state, you might just give your local veterinarian a call, or you can call your Department of Ag animal care folks or your state veterinarian, and they can give you some ideas of where those products can be disposed of as well. I'm not seeing any more questions at this point. Okay, another question that came in: is it detrimental for vaccines and antibiotics to experience multiple temperature changes, even if it's within the acceptable temperature range, or for an antibiotic going to a refrigerator temperature before being warmed up for multiple times? Most of the time, if you stay within that range, you're fairly safe. We do not, we would recommend that we don't want to see a lot of those multiple temperature changes, because every time you have a big temperature change in that product, you have the risk of reducing some of the efficacy with that product. And so if you can maintain kind of that temperature as much as possible, it is usually the best. But again, it's probably more key that if you do have some changes, you stay within the range of that temperature on that label. You'll have the best results there. The ones that get extreme are, like I said, if that product goes from a freezing temperature to a 90-degree temperature in a matter of a short period of time, that's a big fluctuation, and so you can have some efficacy loss because of that. And so that's why we kind of maintain, if we can maintain the temperature as close as possible, is usually the best. And like with vaccines, you definitely want to keep them cool as long as you can in that temperature range before you administer it in that animal. And so again, that one, you need to keep that as cool as long as possible, because the half-life of a lot of those products are smaller, are shorter than some of our antibiotic type of things. We'll wait another minute or so, see if there's any more questions. Wanting to, as we have some time here, a reminder of the next animal care webinar will be October 3rd. The topic there will be on the 2018 Ag Law and Regulation updates for animal welfare and care. And that was going to be, the speaker there is going to be Dave Aiken. And so I know we've had him in the past, a great resource for us in the ag law and regulations for our industries. So again, making sure that we have you back for those. We would greatly appreciate that as well. Well, seeing no more questions, I think we will wrap up for the day. Thanks for participating and attending. This webinar will be is recorded and will be posted at the Animal Care website at University of Nebraska Animal Science Department. Again, we appreciate that. And information will also be put up at the South Dakota State site as well. So thank you again for participating.